Chapter Med 16. We just have week 17 and then week 18.
Well, we don't have week 18.
It's week 17 and then we're done.
This week, who doesn't take hits?
Y'all make sure if you're done with all the pharmacy operation stuff online that you're doing study aids. Get those done. And everybody's done the communication thing, right? And the interview.
Yes, and the HIPAA thing.
HIPAA. Good. Everybody's done that. Just make sure, go back and take your tests if you didn't make at least a 75 on them. So that you can be ready to take the test. And last year I had somebody who had not done that, and so her final consisted of taking a whole bunch of tests so that she could get to the final. So, anyway.
That's crazy.
Okay, so week 16, so we'll take the next week then. To the end of it all. Okay, Spiriva. This is a COPD medicine. You've probably seen commercials for this one online too. Spears like inspiration, explanation. That all should be pretty easy to remember. Serious adverse effects is that it can worsen glaucoma, worsen urinary retention. It has to do with that anticholinergic effect. That has to do with your sympathetic and parasympathetic nervous system. Paradoxical bronchospasm. What is that?
Periodontal bronchospasm?
Paradoxical.
Is that like the stuff around your bronchioles that are spasming?
Yes, so instead of actually making it better, it could make it worse. I don't know why some medicine talking about that. More common side effects are upper respiratory infection. That's with any, if you notice that, anything that you inhale, any medicine that's a inhaler, nasal, whatever, all of those come with the risk of upper respiratory infection. Just because you're putting that directly, basically directly into your respiratory system. Dry mouth, that's what most inhalers do, UTI or chest pain. It's not for an acute attack, so it's not just for like somebody who's like an asthma type attack. This is a long-term medicine, treatment medicine. And I think these usually have, on the end, it says they come with a capsule with a dry powder that must be taken with, it comes with a HandyHaler, and you, it has like a little kind of dispenser, but it actually uses a little capsule, like a powdered filled capsule. But if you close the HandyHaler, it crushes the capsule and the powder comes out, and then you open it back up and breathe in the powder. Okay, Lotensin or benazepril, we know prils are your ACE inhibitors, which are for, what are all ACE inhibitors for? Yeah, blood pressure, okay, hypertension. Headache, dizziness, drowsiness. Want to really watch the potassium, especially if they take diuretics. It's always the case with ACE inhibitors. Monitor with congestive heart failure. It's pregnancy category D. Has an increased effect, so it'll really lower their blood pressure if they're taking a diuretic. Contraindicated with a history of angioedema. So, blood vessel leakage there. Okay, Lamictal. This is an anticonvulsant, so it's for seizures or bipolar. So I'll take this for bipolar maintenance. So some serious side effects, skin rashes, that Stevens-Johnson syndrome, we've talked about that one before, where it's like their skin kind of peels off. Hypersensitivity and multi-organ failure. Great. Suicidal behavior, meningitis, seizures, blood abnormalities, sudden or explained death. So not a medicine you want to play around with. Common side effects, those are all rare, but they're really serious. And then common ones are headache, nausea, vomiting, diarrhea, dizziness, ataxia, so difficulty with moving, drowsiness, what is rhinitis? Yeah, rhinitis basically. Diplopia, what's that? Opia would be what, do you think?
Something in eye.
Diplo or di usually means two. It's double vision.
Right.
Or blurred vision. So interactions, these are some interactions, but not necessarily really contraindications per se. Oral contraceptives, carbamazepine, phenobarb, phenytoin, a lot of these, well, not rifampin, that's an antibiotic, but valproate, some of these are other anti-seizure drugs. All right, Benicar HCT, okay, is a mix of olmesartan and HCTZ. So it's an angiotensin 2 receptor blocker plus a diuretic. So it's a combo drug for blood pressure again. Nausea, dizziness, upper respiratory infection, hyperuricemia. So that uricemia is like uric acid, it's gout related. So monitor renal function. You always want to monitor the kidneys with these. Pregnancy category D. I think most angiotensin 2 receptor blockers are category D. Contraindicated with anuria, just like any diuretic. Why are diuretics contraindicated if they have anuria? This is going to make them try to get rid of all of the extra fluid in their body, and if their kidneys aren't working enough that they can't even pee, then we don't want to give them something to create more urine. And then, of course, there's the hydrochlorothiazide that's going to have its own side effects. So that's just a combo drug. And you'll see that there's other medications that have HCT with them, or sometimes they'll say HCTZ, and that's a combo drug. That means it's got that diuretic in it. That's from all that. Okay, Aricept. This is a medicine for dementia, especially with Alzheimer's. You'll see this. I've seen commercials for this medicine too online. Nausea, vomiting, diarrhea, fatigue, muscle cramps, insomnia, weight loss, and some of the more serious ones are bradycardia or heart block. Everybody remember what heart block is?
It's bad.
Where, your SA node and your AV node don't necessarily communicate very well at differing degrees. GI bleeding, and then they always want to take that one at bedtime. Okay, Risperdal or risperidone, and you'll see this one for sure. This is an antipsychotic. This one I've seen prescribed quite a bit. Schizophrenia, bipolar, especially, so bipolar disease, I know it says bipolar mania on here. You've got two aspects of the disease. You've got the depression side of the disease, and then you got mania side of the disease. And so it's not necessarily, I know we kind of use that word bipolar kind of like a slang term a lot of times, but it's not necessarily quite like the way that we use it in slang terms. It can mean like longer periods, like they go through a longer period of depression and then they go through a longer period of mania. When I say mania, we're talking like, like maybe they go out and they spend thousands and thousands of dollars within a few days. That's kind of like a manic type of episode is what we call it. Or maybe they, maybe all of a sudden they think they're immortal or something like that, and they just do crazy things. Now those are kind of extreme versions of that, but that's the kind of like manic or mania part of that. It's like, it's kind of like a high almost, that kind of idea, like they think they can do whatever. May even have some like delusions, really delusions of grandeur is what we call them, like they think they're the president, or that might be something else that comes along with it. That's probably more of a schizophrenia issue, but it can be that. I mean, it can be that severe. So they may have periods of, really like a depression state, and then it swings over into the mania state. That's really kind of true bipolar. It doesn't necessarily change day to day, like when we think of that. Common side effects, lots of side effects on this one. Most antipsychotics, if you haven't noticed that, have tons of side effects. Headache, insomnia, dizziness, hyperactivity, abdominal pain, drowsiness, fatigue, fever, nausea, weight gain, and like the whole mess. Some more serious ones, the CVA. What's CVA? basic health science here. Come on. You Cerebro. Oh, I was going to say cardiovascular.
Ventricular
Vascular
accident.
Which is a
Bad thing.
stroke.
That too.
Okay, you need to know that one. Woo! Yeah, it's probably been a while since you've seen it. But CVA is a cerebrovascular accident. That's a stroke. Okay. And you'll in the working world, they won't ever say stroke. They're going to say CVA. Tardive dyskinesia, which is kind of a mix of side effects that you'll see with a lot of antipsychotic medications. They may have tremors, things like that that come along with that. Usually tardive dyskinesia, I don't know, I'm not going to say that because I need to look that up. A neuroleptic malignant syndrome, orthostatic hypotension, when they stand up, blood pressure goes down, metabolic changes, blood changes, cognitive motor impairment, seizures, priapism, dysphagia, disruption of body temperature regulation. There's some serious heavy-duty side effects going on. Okay, this is not for a dementia-related psychosis. So not necessarily for use like when we're talking about elderly dementia, like just kind of like your normal progression of dementia. This is specifically an antipsychotic. Not that elderly people couldn't take it or wouldn't take it, but it's not just for, monitor blood sugars if they have diabetes, and then reduce the dosage if they have kidney disease. All right, the next one is glucotrol, and you can guess what this one is for. Gluco. So it's anti-diabetic for type 2 diabetes. This is an oral anti-diabetic. So side effects: headache, dizziness, nausea, vomiting, diarrhea, heartburn, gas, hypoglycemia, and then some other more serious ones, hyponatremia, which is what? Hyponatremia.
Sodium.
Low sodium. Minimize alcohol consumption. Obviously, they need to monitor blood glucose levels, and that needs to be a regular aspect of their care anyway. Of course, it can cause hypoglycemia. They don't eat anything, then they take this medicine to lower their blood sugar. It's going to cause that. And then there's some other medications that can cause the hypoglycemia, so it makes it work even more. NSAIDs, sulfa drugs, warfarin, conazole, beta blockers. And then there's a few that can actually make it go up, make the medication not work. As diuretics, steroids, thyroid medicines, estrogens, niacins, all kinds of stuff. Fioricet's the next medicine on here. This is a combo pain reliever drug. Butalbital, APAP, which is acetaminophen, and then caffeine. So another combo drug, drowsiness, lightheadedness, sedation, shortness of breath, enhanced CNS effects with MAOIs, maybe habit forming it says, but it's not scheduled. Okay, Abilify is another antipsychotic. I've seen commercials for this one on TV too. So schizophrenia, bipolar, major depressive disorder, irritability with any of the autistic disorders, agitation with schizophrenia or bipolar disorders. They get really agitated easily. This is another one, and another long list of side effects. Nausea, vomiting, constipation, akathisia, anxiety, insomnia, restlessness, again with the tardive dyskinesia, suicide, again, a lot of these antipsychotic drugs are like that. Let's see, worsening of depression or suicide risk, don't use in the elderly with dementia-related psychosis again. Okay. Verilin or verapamil, so know that the medications in and out of your calcium channel blockers, again, blood pressure, angina, dizziness, weakness, constipation, fainting, bradycardia, hypotension, like they have the opposite, well, not opposite effect, they can work too well, that's what I should say. So really need to watch digoxin levels if they're taking that and monitor with cardiovascular disease. Well, it may cause profound bradycardia with beta blockers. If this one causes bradycardia, we already know beta blockers cause bradycardia. So combined, they can make their pulse way too low.